gastric bypass, I started to lose a lot of my hair, um, and skin was very dry. So we started on all the products, and I felt within probably about 4 days, I felt like the brain fog had lifted. My joints were not hurting as bad. I was able to move a lot easier, um, and just overall just felt much, much better.
So you can tell that your absorption is a lot better now with this product being able to absorb.
Yes, yes. I spoke to you last week, and sometimes when because of I had the Roux-En-Y gastric bypass surgery, and so I don't have any stomach acid. So we talked about possibly just opening the pills and
Hmm.
putting that all in the water, and that seems to help
Yeah,
a lot because I fill up very fast, even 13 years later, when I drink water, and then I take pills on top of that. So that has helped a lot, and I do feel I can feel the effects more with the hydro daily because it's a liquid form, so that really helps.
yeah. So are you opening your capsules and putting it in the hydro?
Yes.
So you're
Yeah.
just doing everything.
Yeah.
Okay.
Yep.
And so I know you did do the capsules. So would you suggest not to do the capsules or they're okay? It just depends on the person or
Yeah, I think it just depends on the person. My husband is also doing this, and he had the gastric bypass 3 weeks after I did, and
Mhm,
he doesn't have a problem. So I think it just depends on the person,
mhm.
and I just have always had a problem since my gastric bypass with pills and those kind of things. So again, I think it's just, and if you've had gastric bypass, everybody is different in the foods they can eat and what they can do and what their body does. So
So is your proportion still very small that you can deal with?
yeah, I mean, it's not as small as when I first had my surgery. But yes, our doctor was amazing, and the product, he came up with a solution to help us um still have that feeling. And so even 13 years now, I still feel I still know when enough is enough. So yeah.
Yeah. Well, that I mean that's good. I mean, if you're gonna have that surgery, that's what you want.
Yeah. Yeah.
'Cause I do
Yes.
know a lot of people that don't have that feeling and they've stretched back out and that
Yes.
kind
Yeah.
of yeah.
Yeah, yeah. He told us. In fact, we were one of the very first patients that he tried it on, and he just put a mesh sleeve over the new stomach,
Mhm,
and so it allows the stomach to expand, but the mesh sleeve brings it back. And
mhm.
so of course I did gain some weight back, but still I still have all the feelings. Again, it's not as severe as when I first had the surgery, but it's still there.
Well, I'll be anxious to see down the road. I know you've been doing this, I guess, 2 months now,
Yes,
that,
ma'am.
your hair and that, and,
Yeah.
just the continuance of healing with the product. Now, my question to you is, would you recommend the dosing that you have? You don't have to say what you have, but would you recommend that dosing that we went over for you to do?
Abs- Absolutely. Yeah. Yeah.
Mhm,
It again, I just feel overall better. I just feel I think you can tell when you are low on a lot of things,
mhm.
with vitamins and your energy level and those kind of things. And so absolutely I would continue, and I would recommend exactly what you guys told us to take.
Now I have another question, but I don't name any companies or whatever. Have you
Yes.
tried a lot of different vitamins throughout your 13 years for absorption and that?
Yes. Yeah. If you're a bariatric patient, there's a lot of bariatric companies out there that have vitamins, and they just never seemed it worked, but it just never seemed to do enough, if that
Mhm.
makes sense. Like it just never seemed to get you over that hump. And so with the Hydro Daily and the others, you definitely can feel that.
Well, that's one thing great about Dr. Prasad being going after all the systems at one time and
Mm-hmm.
supporting them, but then also too, it's in the right combination, quantity, and form, so we're not overlapping and we're not
Right.
canceling out, and then we don't have the vitamin C mixed with copper, iron, or manganese that
Yeah.
causes more oxidation in the body. So,
Yeah.
and I know the biggest problem with this type of surgery is absorption into the
Mhm.
small intestine.
Yes.
So,
Yeah. Yeah. Um, and I have had to have iron infusions and everything with this gastric bypass, and nothing um and I'm not just saying this, but nothing has made me feel as good as the Hydro Daily.
so what would you say to somebody that has the gastric bypass surgery? If you were talking to them, what would you say? Because I know a lot of people are fearful of starting anything just because they
Hmm.
don't know how they're going to feel. So,
Yeah.
what could you say to inspire somebody that was in a fearful thought process?
If you can take the step to have gastric bypass surgery, which completely changes your life, um, I think just knowing how good I felt after my gastric bypass surgery, that this just takes it to the next step. With the hydro, it makes me feel so much better. My body feels better. And if you can just take that first step, we always are fearful when we have to take just that one step. But if you just take the one step, I know that it will it will definitely come back and help you so very, very much.